In this video, I'm going to explain movement of hip joint. Hip joint basically can do 6 movements. This way of movement, and this way of movement, and this way of movement. I'm going to explain these 2 movements first. This is flexion. This is flexion. This is extension. Flexion is when you raise up leg this way, forward. Extension is when you do back kick, like this movement. Basically, anterior part of hip muscles do flexion, such as rectus femoris, psoas, iliacus, tensor fascia lata. These anterior hip muscles, they do flexion, okay? On the other hand, posterior part of hip muscles do extension, such as gluteus maximus, that's very, very big muscle. Hamstrings, okay, that's also very big muscles. Gluteus maximus and hamstrings. These 2 muscles are main hip extensors. Of course, other muscles can do extension. However, big 2 muscles are gluteus maximus and hamstrings. Okay? Flexion, extension. Flexion, anterior muscles do flexion. Extension, backside of hip muscles do extension. Okay, let's talk about this kind of movement, abduction, adduction. Because this model cannot do abduction, adduction, so I use figure model, okay? This is abduction. This is adduction. Abduction, open leg, this way. Adduction, close leg, this way. Abduction, adduction. Lateral part of hip muscles do abduction, such as gluteus medius and gluteus minimus. These 2 muscles are main hip abductor, okay? Raise leg, sideways, this way. Abduction, gluteus medius and gluteus minimus. What about adduction? Mainly, hip adductors do adduction. That's simple, right? Adduction, adductors. Very simple. Now let's talk about internal rotation and external rotation. Rotational movement. Internal rotation is this way. External rotation is this way. Same as flexion. Anterior part of hip muscles do internal rotation, such as tensor fascia lata, and some adductor muscles do internal rotation. Okay. However, internal rotation is not very strong in human body. Rather, internal rotation, external rotation is more powerful. Okay. So what kind of muscles do external rotation? Let's say gluteus maximus. Again, gluteus maximus, that's very strong muscle. And deep lateral rotators on hip joint. Imagine there are tiny, tiny deep muscles here, posterior part of hip joint. These guys do external rotation. Okay? Internal rotation, tensor fascia lata, and some adductors. By the way, iliacus and psoas do not do internal rotation. They actually do external rotation because think about its vector. Let's say this is psoas. It attaches on lesser trochanter, very deep part of femur. Imagine it runs like this. If psoas pulls femur this way, that makes external rotation because it's very deep. If muscle pulls femur this way diagonally, that makes hip external rotation. Does it make sense? Iliacus and psoas are anterior part of hip muscles. However, they do external rotation. So in this video, I explained 6 basic movements of hip joint. Flexion, extension. Anterior muscles do flexion. Posterior muscles do extension. Abduction, adduction. Lateral part of hip muscles do abduction. Adductor muscles do adduction. Simple. Adduction, adductors. Okay? Internal rotation, again, tensor fasciae latae, anterior part of hip muscles and part of adductors. Okay? External rotation, gluteus maximus, deep lateral rotators, iliacus and psoas. Understanding these muscles and movement are very, very important, okay? I hope this video helps you understanding of anatomy. If you liked today's video, please hit the like button, comment and subscribe. See you next video.